Hi, I'm Naomi Tatro. I am a registered nurse out here at Salina Tech. I teach in the Allied Health Department as a CNA and CMA instructor. I've been out here for a little over 8 years, and most of my registered nurse background training has been in geriatric care, taking care of the long-term care resident, and also I do have some acute care experience as well as some home health care experience and director of nursing experience. A CNA, a certified nursing assistant, their job is extremely important in the healthcare field, as a lot of times they are considered the backbone of the industry. They are the ones with doing all the hands-on work with the patients and the residents. It's important that they are trained properly to provide the utmost dignified and respectful care to the resident. They do everything with ADLs, which is activities of daily living, such as bathing, dressing, grooming, oral care, feeding, ambulating, and then there's the emotional and spiritual support side of it as well. Med Aides, certified medication aide, they also work in long-term care facilities typically, and they are the ones that are passing the medications to the residents, and typically will do most of the meds that include oral meds, topical meds, eye drops, ear drops, things like that. We have the Certified Nurses Aide courses in 2 different scenarios. We offer them here on campus in usually a 6 to 8 week time frame, and then we also go into the high school where we offer them by the semester. So for example, the spring semester, that CNA student has started the class from January to May. But most of our courses here on campus are much shorter, 4 to 6 to maybe even 8 weeks depending on the hours. The CNA part is actually kind of the first step up into healthcare. You don't need any prior experience. You just have to want to have a passion to help people, be patient, be respectful, and have a willingness to learn. This is a great starting point for students to get their feet wet a little, not commit a whole lot of time or money for that part. CNA a lot of times will either help a person determine, yes, they want to go further into healthcare, or they absolutely do not want to. And that is perfect. That's a great solution, because you're not investing a whole lot of time or money at that point. Most CNA students do continue on into healthcare, and they'll go anywhere from into a home health aide scenario. A lot of them go into nursing, physician, therapy, dietitian. Gosh, we've had students do all kinds of things. So it's a great starting point for anyone even considering getting into the field. We can't keep up with demand. There's no way. Everywhere I turn, everywhere I look, people are asking me, when's your next class? Can I come talk to your students? I would say for every CNA student that we put through the program, we could probably tell them about 5 to 10 jobs easily. The demand is huge, and it's getting bigger.